It never announces itself with chaos. No alarms. No dramatic collapse. Just a quiet shift in the background of your life. A flicker of exhaustion you can't explain. A mild discomfort you brush off. A shadow on your skin you barely notice. These aren't warning bells, they're whispers. But what if those whispers were the first signs of something far more serious? For those over 60, these seemingly harmless changes can be the earliest clues of cancer, the kind that hides in plain sight, waiting. The truth is, nearly 6 out of 10 cancer diagnoses happen in older adults. Not because the signs weren't there, but because they were too quiet to catch. You see, we've been taught to power through. To normalize fatigue. To ignore the strange. To convince ourselves that growing older just means feeling off sometimes. But what if that mindset, what if that silence, is what lets cancer grow unnoticed? This video is your moment to pause. To look closer. Because we're uncovering the silent, subtle, easily dismissed signs that could be your body's first cry for help. The ones doctors often miss. The ones you've been trained to ignore. And the ones that, if caught in time, could save your life. So before you wave away that unexplained pain or tell yourself, "I'm just getting old," watch this. Because today, we're not just talking about symptoms. We're learning to hear what your body's been trying to say all along. Number 1. A feeling that something is off or general unwellness. It may not sound alarming at first, but this subtle, hard-to-describe sensation can be one of the earliest signs your body is waving a red flag. Many seniors with early cancer don't have any dramatic symptoms. Instead, they describe a vague sense of feeling not quite right. It's hard to explain and even harder to diagnose, which is why it gets ignored so often. You might feel more tired than usual, a little foggy, or like your usual activities take more effort. Some people say they feel oddly anxious or off balance even when everything else looks fine on the surface. This could be your body reacting to chemical signals released by cancer cells which alter immune and neurological functions. Others experience strange low-level symptoms like a mild sore throat that never goes away, unexplained chills, or random low-grade fevers. The key here is duration and consistency. If you've been feeling unwell in a way that's hard to pinpoint and this lasts for weeks, it's not something to brush off. Doctors may recommend a broad panel of blood work and scans to uncover hidden illnesses. And while it may turn out to be something minor, there are countless stories of people who caught their cancer early simply because they listened to their intuition. You know your body better than anyone. If it keeps whispering that something's not right, listen. Number 2. Changes in your nails or fingertips. While we usually focus on more obvious symptoms, sometimes the body sends its first cancer clues through something as overlooked as your hands. Your nails might seem like an odd place to look for cancer signs, but the body has its ways of sending subtle messages. Clubbing, where the tips of the fingers become rounder and the nails curve downward, can be one of the earliest signs of lung cancer or even gastrointestinal cancers. This happens when oxygen levels in your blood drop over time, triggering changes in the nail bed and soft tissues of the fingers. You might notice your nails becoming spongy, shiny, or slightly painful to the touch. Another sneaky sign is the sudden appearance of dark vertical streaks in the nails, which may indicate a rare form of skin cancer called subungual melanoma. Sometimes nails can also become unusually brittle or have pits and grooves that weren't there before. Seniors often assume these are normal aging effects or signs of nutrient deficiency. But if these changes appear quickly or affect only one finger, it's a sign to investigate further. The problem is most people don't think twice about their nails unless they break. But when nail changes come out of nowhere and persist, doctors may order blood tests or chest imaging to rule out internal causes. It may seem like a small thing, but sometimes the smallest clues are the most urgent. Number 3. Bone pain that has no clear cause. It's not uncommon to have a few aches as we get older, but certain types of lingering, unexplained pain deserves a closer look, especially when they just won't go away. A little back pain here, a sore shoulder there, aches and pains are part of getting older, right? But when you have chronic unexplained pain that lingers or worsens, it could be a hidden sign of something much more serious. Cancer-related pain is tricky because it doesn't always start at the site of the cancer. A tumor in the pancreas might cause persistent back pain. Prostate cancer could cause aching in the hips or thighs. Bone pain or deep joint aches may also indicate bone metastasis where cancer has spread. What makes this type of pain different is its persistence and intensity over time. It doesn't respond well to painkillers. It might be worse at night and it often grows stronger gradually. Some seniors described it as a deep gnawing ache that doesn't behave like normal arthritis. Others say it's sharp even when resting or seems to shift around the body. This happens because cancerous growths can press on nerves, bones, or soft tissue, causing inflammation or damage from the inside. So, if you've been nursing the same sore spot for weeks, and it's not improving with rest, stretching, or over-the-counter meds, that's a red flag. Doctors may start with X-rays or MRIs to rule out structural causes, but bone scans, or PET scans are often needed to identify cancers that aren't yet visible on traditional imaging. Don't let pain become your normal, especially if it feels off from your usual aging discomfort. Number 4. Unexplained night sweats. You might think waking up drenched is just a reaction to a warm room or a bad dream, but recurring night sweats can reveal something far more serious beneath the surface. Waking up drenched in sweat despite sleeping in a cool room with light covers isn't just uncomfortable, it can be a serious warning sign. While night sweats are often brushed off as menopause-related or blamed on bad dreams or warm weather, they can actually be a subtle early symptom of certain cancers, especially lymphoma or leukemia. What makes night sweats cancer-related is how they happen. They're usually intense, drenching, and occur consistently, often without a fever or any sign of infection. You might find your pajamas soaked or even have to change your bedding in the middle of the night. These sweats are triggered by inflammatory chemicals released by cancer cells which can disrupt your body's temperature regulation, especially during rest. In some cases, night sweats are accompanied by mild fever, unexplained fatigue, or slight weight loss. But they can also show up on their own. What's dangerous is how easily this symptom gets ignored. People think it's hormonal changes, stress, or even a side effect of medications. But if you're not actively sick, haven't changed your routine, and still wake up sweating for more than a week or two, it's time to talk to your doctor. A blood test or imaging scan might be recommended to check for deeper causes. Cancer-related night sweats don't go away with fans or cooler blankets. They're your body trying to alert you to a serious internal shift. Number 5. Skin that suddenly looks or feels different. Our skin doesn't just shield us from the outside world, it often whispers warnings about what's going on deep within. While it's natural for skin to lose some of its moisture and resilience with age, not all changes should be brushed off as signs of getting older. If you begin noticing patches of skin that feel rough, look discolored, or seem irritated without any clear cause, it might be something far more serious than aging. These changes can sometimes be the earliest indicators of skin cancer, or internal cancers affecting your immune or blood systems. One subtle but troubling sign is persistent itching in a specific area that doesn't improve with lotions or medication. In other cases, the skin may appear red and inflamed, resembling eczema, or develop a yellowish hue, possibly hinting at liver dysfunction. There's also a lesser-known condition called acanthosis nigricans, in which folds of skin, particularly around the neck or underarms, become unusually thick, darkened, and velvety. This strange texture change has been linked to insulin resistance and, in some cases, gastric cancer. Another warning signal is if minor injuries suddenly take longer to heal or unexplained bruises start showing up on your body. These can point to blood-related cancers like leukemia, where your body's ability to repair itself is compromised. What matters most is consistency and location. If these changes appear in areas not regularly exposed to sunlight and don't fade over time, it's not something to ignore. Doctors may recommend a skin biopsy or blood work to uncover what's happening beneath the surface. Your skin may be trying to tell you something urgent. The key is to pay attention before the whisper turns into a scream. Number 6. Strange or new stool changes. It's uncomfortable to talk about, but changes in bowel habits often tell us more than we'd like to admit, sometimes revealing what's happening deep within. Many people assume that constipation, diarrhea, or odd-looking stools are just related to food or hydration. And while that's often true, if these changes become persistent, lasting more than a few weeks, it could be an early indicator of colorectal, pancreatic, or liver cancer. One of the biggest red flags is a change in stool color. Pale clay-colored stool may indicate a blockage in the bile ducts caused by a pancreatic or liver tumor. Dark or tarry stools could suggest bleeding in the upper gastrointestinal tract. If your stool is consistently narrow, almost like a ribbon, it may be due to a mass pressing against the colon. The scary thing is most people dismiss these signs as diet-related or minor gut issues. But if you're noticing that your bathroom habits have changed dramatically and they're not going back to normal, it's time to dig deeper. You might also notice increased bloating, an urgent need to go but nothing happens, or a sensation of incomplete evacuation. These symptoms point to something affecting the normal movement of your digestive system. And remember, your stool is one of the first places your body reflects internal problems. Don't ignore the signs that something deeper may be brewing. Number 7. Eye pain or changes in vision. Your eyes don't just reveal age, they might be the windows to early signs of something far more serious, like cancer. Eye pain is rarely associated with something as serious as cancer, which is why it's one of the easiest signs to overlook. But seniors who suddenly develop persistent eye discomfort, blurry vision, or floaters that don't resolve could be experiencing one of the more unusual early symptoms of cancer, particularly ocular melanoma, or even cancers that have spread to the eye from other areas such as the breast or lung. Eye-related cancers can affect the retina, the optic nerve, or the tissues surrounding the eye. Symptoms often begin subtly. Maybe you start seeing flashes of light or objects look slightly distorted, or one eye becomes blurry while the other stays sharp. Some people describe a dull ache behind the eye that won't go away or pressure that feels like sinus tension. Unlike normal aging vision changes, these symptoms tend to worsen or persist, and they're often missed during routine eye exams. If a cancer spreads to the eye, it can also cause double vision or difficulty seeing at night. An ophthalmologist may need to use a special ocular ultrasound or retinal scan to look deeper into the eye. The problem is if you wait too long, the damage can become irreversible and even life-threatening if the cancer spreads. Don't chalk it up to just getting older. When your eyes send a warning, take it seriously. Number 8. Persistent heartburn. It's one of the most common complaints in older adults, but persistent, unexplained heartburn may be much more than just digestive discomfort. Everyone gets heartburn occasionally, especially after a heavy or spicy meal. But if you're over 60 and experiencing frequent or chronic heartburn, especially if it's waking you up at night or making it hard to eat, it could be more than just an upset stomach. This kind of persistent acid reflux could be a subtle warning sign of esophageal or stomach cancer. Many seniors assume it's just indigestion or a normal part of aging. But here's the problem. When acid frequently rises up into the esophagus, it can cause chronic inflammation known as Barrett's esophagus, which significantly raises the risk of cancer over time. The discomfort may start as a mild burn behind your breastbone or a sour taste in your mouth, but over weeks or months, it becomes more frequent and harder to manage. You might also notice food getting stuck while swallowing, a hoarse voice in the morning, or the need to take antacids daily just to feel comfortable. When cancer is involved, the tissues in your esophagus or stomach lining begin to change at the cellular level, and that irritation doesn't go away no matter how carefully you eat. Doctors often use endoscopy, which is a small camera passed through the throat to check for abnormal tissue changes. So, if you've been battling heartburn for more than a month and it doesn't improve with diet changes or medication, don't ignore it. It could be your digestive tract's quiet call for help. Now that we've explored the silent signals our bodies may send when cancer is developing, let's turn the spotlight on something empowering, your plate. Science continues to affirm that food isn't just fuel, it can be one of the strongest allies in the fight against disease. While no food offers absolute protection, incorporating certain ingredients into your weekly meals can help your body build stronger defenses against cancer. Let's begin with a vegetable you've likely seen at every healthy dinner table: broccoli. This green powerhouse contains a natural compound called sulforaphane, which has demonstrated remarkable anti-cancer properties in numerous studies. Sulforaphane works by neutralizing harmful compounds, reducing inflammation, and enhancing your body's detox systems, especially in the liver. One landmark study followed tens of thousands of men, and discovered that those who ate cruciferous vegetables regularly lowered their risk of developing aggressive prostate cancer by nearly a third. If you want to retain those cancer-fighting benefits, skip the boiling and lightly steam your broccoli for just a few minutes, just enough to soften, not strip its power. Next up, let's talk about tomatoes: vibrant, versatile, and more protective than they appear. Tomatoes are brimming with lycopene, a bright red antioxidant linked to reduced rates of several cancers, especially in the lungs and prostate. Research shows that men who consume tomato-based dishes more than 10 times a week experienced up to a 35% drop in prostate cancer risk. And here's a fascinating twist: lycopene becomes even more potent when heated. So your homemade marinara sauce or roasted tomatoes aren't just delicious, they're armor for your cells. Just be sure to choose fresh or minimally processed options without unnecessary sugars or additives. Finally, let's not forget nature's sweetest medicine: berries. Blueberries, raspberries, and their colorful cousins are tiny fruits packed with extraordinary strength. They're loaded with anthocyanins, ellagic acid, and vitamin C, compounds that neutralize dangerous free radicals and reduce chronic inflammation. In animal studies, diets rich in berries led to drastic reductions in tumor formation. And human trials consistently show lower levels of oxidative stress and improved immune response in berry lovers. Their high fiber content also supports gut health, which plays a critical role in immune surveillance and cancer defense. Add them to your yogurt, toss them in a salad, or eat them fresh. They're a delicious, low-calorie shield against disease. Remember, no single food is a magic cure, but day by day, bite by bite, your choices add up. And these 3 foods can make a powerful difference in your long-term well-being. Now you understand, the danger isn't just in what we see, but in what we choose to ignore. The subtle changes, the quiet discomforts, the patterns we brush aside, these are often cancer's first footsteps. It doesn't come roaring in. It whispers. And those whispers are easy to miss, until they're not. But awareness is everything. It's what transforms fear into power, delay into action, and uncertainty into control. If anything you heard today made you pause, if a symptom sounded too familiar, don't wait for clarity to come too late. Talk to your doctor. Follow your instincts. Your body knows. It's been trying to tell you. And if this video opened your eyes, even just a little, we hope you'll stay connected with us. Click subscribe, turn on the notification bell, and join a growing community committed to health, truth, and early action. Because what you learned today could protect the life you love tomorrow. Share this with someone who needs it. Because sometimes, one video, one conversation, one brave moment, is enough to save a life.